All right, so in terms of understanding AI, the way I like to think of it is three types of AI. There's the old school AI, and there's machine learning, and there's machine learning and big data, and then there's machine learning, which is generative AI. So I'll discuss all three. Okay, so in terms of the old school AI, it's basically a bunch of rules. Um, just slightly missing. It's a bunch of rules, and it's basically um, that experts basically sit down and decide things. It's if in your old, you might have had classes in school. We learn a little bit about computers with if-then statements. It's a lot of that sort of stuff, and it works, but it has its challenges. And we do use them for expert systems, but the new technology does a lot more. You have to decide for this old school AI who your experts. You have hard cutoffs, such as let's say a blood pressure of 70, whereas blood pressure of 71 or 69, maybe different category. You have to figure out how the rules are maintained as they change over time. And most of the rules tend to have things in them at some point saying that aren't detailed enough, where it says at the discretion of the clinician. The second one I'll talk about is a big data and basically categorization of data. So this is involved in looking at the raw data itself, not so much asking experts what they think, but looking at the data. And this is a graph of comparing things on two coordinates and trying to figure out how do we draw a line that separates those two so that we can basically classify systems into being one or the other. And so when new things come in, they get divided up accordingly. So there are rules in here, but the computers are kind of figuring out the rules. They're figuring out how to make the distinctions between things. And again, this obviously gets more complicated, but it's at a conceptual level. That's kind of how I think about it. There's a physician at Mass General Hospital made a comment about every hospital should follow every patient it treats long enough to determine whether the treatment has been successful and to inquire, if not, why not, with a view of preventing similar failures in the future. I thought this quote was something that really epitomizes me of what you're trying to do with big data. It's always learning from the data and always improving. Now, this quote happens to come from 1917, but I think it still applies today. When we think of big data and what's changed over time compared to the old school, a lot of it has to do with what I think of as three things. And I'm going to do a little bit of a quiz for you guys. The first is, does anyone know what this is? Take a look at it, see if you can figure it out. If you don't know, I will tell you. Yes, it's a clock, but it's a little bit more than a clock. It's a timestamp. In the old days, if you went on a train or something and they wanted to stamp the time, they might actually have use a timestamp like this, so the date and time are imprinted. And the reason I put that there is because with all our AI systems these days, we're collecting data constantly, even when we don't know we're collecting it. Some refer to this as digital exhaust. So we have a lot more data than we ever had before because we're collecting all these various types of data as part of operationally doing whatever we're doing. It's every time you use an electronic system, every time, any sort, whether it's within your work or even a credit card or make a phone call, there's a big data exhaust that we're all creating, and that is a source of information for big data. So here's another question. What does this look like to you? And I think most people would look at this and say it's probably a face. I hope you can see that. See little eyes and see a nose. There's not much information here. The information appears to be kind of blurry because it's a low information. It's not a high resolution picture. But what is this really? Well, it's me. I basically just took a picture of myself and blurred it to show this example. But you can see when you see a high level image, the questions you can ask about it are just very different questions. You can ask questions about who exactly is it? What is their mood? And various other things that you couldn't ask otherwise. So by having data in more detail, you can just ask questions that can't be answered, asked with simple data. Here's something, see if people recognize what this is. Now, some might recognize this as a gene sequence, but the question then becomes, what gene sequence? And the answer is, it's a sickle cell trait. And what I'm trying to show here is that there's data that exists now that the humans can't even interpret, even if they wanted to. I showed this to a room full of experts, and no one was at Harvard School of Public Health, and no one recognized what it was. And I wouldn't expect someone working in the field of sickle cell to recognize this. It's just too hard to interpret. So we need computers to interpret some data that for us is just unintelligible otherwise. The third type of thing I want to talk about, just understanding AI, is the generative AI, and that seems to be the hottest craze lately. And I just want to give a conceptual understanding of it. I think it's relevant. In this case, if you start with something such as the phrase "the sky is," uh, computers are really good at turning that into a series of numbers, and each of the numbers can be thought of as a dots. And then when it takes those dots, it can apply math to those dots. Each one that one gets calculations, and every arrow represents a calculation to a new set of dots. And then applies math to those dots to give a new set of dots. And finally, that results in an output, in this case, blue. The sky is blue. So effectively, you give inputs to the system, you get outputs. The logic on each one of these arrows is non-existent. What basically the computer does is does effectively something similar to a trial and error, a little more sophisticated, obviously, until it figures out what series of weights on the arrows give it will allow them to take the sky is and result in blue. And then it changes the phrase to say what time is, and those same arrows need to now give it. And it basically takes a whole bunch of time and effort to train these systems to be able to make these outputs. But effectively, the logic behind how it does that from an intellectual point of view is a bit of a black box. We don't know why it uses the math equations that it does, but it does seem to work. And this type of architecture can be expanded greatly. And ChatGPT is an example of how it gets expanded. So you can have 1.8 trillion parameters, trillion dots, off of 120 layers. It could take a long time to train and cost $100 million to train. And if you do make it big enough, it has emerging properties that cannot be predicted. You get fascinating responses to prompts that are original and useful, and you don't really understand where it comes from. But it is useful, and it is interesting, and incredibly valuable. And that's the third level of what I'm describing, is that incredibly useful stuff that is we're now learning to interact with now. So that's the basic understanding of what is AI. I want to talk a little bit about the current and future state of applying it, especially to healthcare and mental health. Um, this is a study from 2003 from Medscape, and basically it's showing that providers are recognizing AI and recognizing the opportunities, maybe not fully utilizing it yet, but are basically seeing that can be used for treating patients, communicating with patients, diagnosing conditions, and the various things shown in this list. So this is something that's happening, and it is being recognized, although obviously not fully implemented yet. This was a survey done at an American Psychiatric Association meeting, and it shows the degree in 2003 in which therapists, or psychiatrists in particular, recognize what AI is doing and can do in the future. So will already does improve diagnostic accuracy, will already does decrease disparities in healthcare, documentation is more efficient, and clinicians need more support training in understanding these tools. So in particular, I see 80% say they need more training. So people aren't really, at least in 2003, hadn't adopted it yet, but they see what's coming. So what can some of these things do that are kind of surprising? Here's one of the examples. Here's ChatGPT performing on a board exam and doing better than the students, which is kind of surprising. It wasn't trained particularly on these exams, but yet it was trained on medical knowledge, and yet it was able to do better than the students. Here's one that was interesting, in which they had some providers, this is primary care providers, interact with patients through chat. And they had ChatGPT interact with these patients through chat. And they found not only did the ChatGPT do a little better than the physicians in terms of the clinical aspect, but they also did pretty well, did better than the providers in terms of empathy. And one of the thoughts is, obviously this is not how most providers practice. They don't practice through chat. And so and it's painful to have to type everything you want to say in chat. But with the caveat, it's still pretty impressive that the technology did as well as it did. A lot of examples of what can be done in AI come from radiology, because radiology was the first department to go fully digital. This is an example in which an organization screens for COVID-19 pneumonia in patients uh, entering the emergency room without a radiologist review. So it hastened the ability to get the patients into the right treatment. And there's an example of something that's a little unusual. I found this study in which the AI was able to recognize the race of the patient through the regular X-ray. Not something clinically most relevant in this case, but what it's interesting to say is that it can see things that radiologists may not be able to see. AI can interpret things that humans may not be able to comprehend. So, how could it be used in mental health? It can be used in screening patients who need higher care, particularly seeing that for depression screening. Um, Ambient clinical note dictation, and we'll talk more about that, but that's the idea that the system listens to a conversation, and just from listening, it transcribes the note and then makes a documented note from the encounter. Responding to patient messages, patients send in a lot of message, and a number of providers have work queues that they have to keep up in responding to patients, and the AI seems to be able to do a reasonable job at that, although the question is how much do you trust it? Justifying a rationale to an insurance company. Um, the system knows what this clinical situation is, and if a provider can basically type up a letter to the insurance company a little faster with some good references, that can be quite helpful. Just be careful that if you use it for that purpose, please check the references. There have been cases in which the system makes up references when it doesn't know them. So please check the references if you use it for something like that. Um, Explanations in user-friendly language. I've heard examples in the emergency room where uh, providers wanted to explain something to a patient and have a written document, and it asked ChatGPT or other language models to do that in, let's say, a seventh grade level or whatever it might be. So it can be used for that sort of thing, which saves providers time. You can give it very focused tasks to work with people on. I've heard it being used for mindfulness training. I've heard it being used for role play exercises. I actually created one AI that did it not for mental health purposes, but for the work environment to role play having a difficult conversation with an employee according to a certain model of how those discussions should work. And potentially therapy, the cognitive behavioral therapy. And I'll talk a little bit more about that and what that means. So, in terms of predicting the future, I think this quote is interesting. It comes from someone who just won a Nobel Prize for his work, particularly in AI and physics. And he said, I think that if you work as a radiologist, you're like a coyote that is already over the edge of a cliff, but hasn't looked down. So he does not yet realize that there's no ground underneath him. People should stop training radiologists now. It is just completely obvious that within 5 years, deep learning will do better than radiologists. And so that's a pretty credible warning that people should, that I think means a lot, especially coming from a Nobel Prize winner. The challenge is, he publicly stated this in 2016. So he is a little bit ahead of his time. I happened to find this article this week. Radiologist shortages will persist into 2055 without counteraction. So clearly he was wrong, and I don't want to pick on him too much because he's obviously a brilliant guy, and I'm not sure if I was in a situation I'd do any better. But I want to give him credit. But I do want to point out that people are making a lot of predictions, and it's hard to predict the future. As Yogi Berra said, it's tough to make predictions, especially about the future. So in that context, I thought it'd be interesting to show a study that just came out pretty recently, March 27th. Randomized trial of a generative AI chatbot for mental health treatment. So they did a randomized trial to see how well an AI chatbot did in treating certain conditions, particularly it was depression, anxiety, and eating disorders. And the quick result is it had a clinically significant positive effect. I'm not showing the data here, but it also is something that the patients seem to like. There was even a measure that they used for other studies to talk for how well patients developed a relationship with their provider. They used that same metric and showed that patients developed a good relationship with the AI. So that's a pretty significant finding. I should also point out in this that they screened out suicidal tendencies, mania, and psychosis. So they tried to limit it in certain ways, which may not be realistic for the real world, but at least for this, it kind of made it a safer study. They also had clinicians look at every one of the AI responses that went back to assess and make sure it wasn't making medical recommendations that it shouldn't have been making. But it's an example of where the technology is going. It's not there ready for prime time yet, but people are looking into this to see what it can do. So that's my thing about what the systems can do and where things are going. But now it's a question of what should it do? And in the ethical considerations, there are a number of things to think about. One of them is, what's the role of AI? And there are some situations which I think are just much more brittle than others. Is the AI making suggestions for you to consider? Is it screening patients in some way? Is that to show you the ones who you want to give a little more attention to? Or in the one that's most brittle, is it ruling out patients that don't have to be considered, or ruling out situations that you don't have to consider? And I think as AI systems, the more autonomous they are and actually providing a comprehensive solution to a patient in the extreme, the more care must be taken to make sure that it doesn't make mistakes, and the more the ethics become even greater. When an AI deals with an expert in the field, for example, you can count on the expert in the field to know how to assess what's being suggested to it. And there are trade-offs. Sometimes you can't optimize for everything. You might want to do no harm, and obviously you want to maintain autonomy. You want to have equity and justice. You have to have responsibility for everything that's going on, transparency, confidentiality, and privacy. These are all important aspects. So I'd love to talk about more of these in detail, but as I prepared this talk, I thought what would be most useful is not talk about the ethical terms per se, but just come up with ethical scenarios or questions that I could present to the group. And this is not as much in ethics. It's not saying what's right or wrong. It's putting it out there for it to be considered. So 14 ethical questions. First, what must be done to protect private data? And it's kind of an obvious thing that protecting the data is critical, but how much effort needs to be done? How much needs to be anticipated about? One of the trade-offs is as organizations are often responsible for limited resources and allocating them appropriately. So you can never make something perfectly protected. So what level of protection do you put in? And when do you put it in? So for example, a lot of data falls under regulation because it's clinical data and you have to abide by the rules. But if you look at, let's say, maybe some of the well-being apps on the internet, they don't fall under the clinical rules. So they're not, at least legally, at least as far as I know, obligated to protect it in the same way that a lot of the clinicians are to protect their data. And how do we manage those types of situations? How informed must clients be about AI? In some cases, if the AI is being used behind the scenes, do they even know that their data is being passed through an AI algorithm? Do they need to know? Or if someone's interacting with an AI, there was someone who created was a company that was doing some counseling online, and they used a chatbot to do some counseling and didn't tell the patients. And the way it got out was he didn't think anything was wrong about it, so he actually did a post, and I think it was a Twitter post or something, where he basically talked about what he had done. And so, what are our ethical obligations to keep the patient informed about what we're doing with AI and how it might be affecting them? What are the risks of AI becoming a barrier to desired interactions? So one of my pet peeves is it used to be when you called a phone line, it said press 1 for this, 2 for that. You can always press 0 to get an operator. And AI has the ability to relieve some people from mundane tasks and give people a more immediate access to an AI system that answer their basic questions. And that will hopefully free up therapists to have more valuable interaction, maybe take over some of the administrative burden. But the thing we have to be careful about is, as things become more efficient and economically more feasible, we don't let the AI become the barrier to getting to speak to the people that we want to speak to. So how do we prevent that from happening, even though there might be financial incentives to do just that? When should clients be able to opt out of using AI? And I was thinking back when I'm old enough now that I remember when electronic medical records were coming into use, we had questions about, should patients be able to opt out about having their data on an electronic system? But at some point, it became the standard of care. And now systems generally don't offer the option of a paper record. It's felt to be less safe and something that organizations don't even know how to manage. That may also happen with AI. There may come a point where, and I can think of an example where people are writing about doing a colonoscopy, that they use a AI system to make sure polyps aren't missed. If you don't use the AI, the provider may not feel safe or feel comfortable doing the procedure. So at what point does it get to the point where we don't give patients the ability to opt out? When do we, and when don't we? Again, I'm putting it out there as questions, especially as this technology advances. Who's responsible for mistakes or poor outcomes? Generally speaking, you hear comments like, go ask your doctor. But if the AI system was designed by someone and it was designed inappropriately, is that system commit malpractice? Or is it the clinician who used that system who made the mistake? And how do we work out those issues? What is a reasonable expectation for preventing unanticipated consequences? And I use the word unanticipated on purpose because I don't think it's the same thing as unpredictable. I think a lot of these things can be predicted. We know, for example, that AI systems, especially the newer ones, have random errors, sometimes called hallucinations. We know that systems drift. So a system that is built and working and tested and works well today, 6 months from now, things might change and it may not work well, or it may not work in a different environment. We also know there's examples of systems having bias, where you ask the same question, give a scenario to an AI system and say black patient, another scenario you say white patient, it gives a different diagnosis. Or it doesn't always, but there are systems that have been built that do give different diagnoses. So we know these systems are can have problems. Now, some of these problems might be things that are not necessarily worse than the human systems that they're emulating. But still, what's a reasonable expectation for those building and using the systems to anticipate some of those things that go wrong and then work to prevent those problems? What are the cost implications? How much does it cost? What resources are being used for this that are being diverted from something else? And if some people or systems can't afford those costs, is that appropriate? Is that right? What's the basic level that everyone should have a right to? Who owns the data? That's in terms of building the systems, such as the lawsuit New York Times has, where they're basically arguing that their data is now being used for purposes that they never authorized, or even patient data. As we think about the business model of a number of companies is owning the data, as in Facebook owning data that you might put on their system. And then sometimes this thing gets complicated if the company goes out of business. There's genetic data on 23andMe, and now that's owned by a company going out of business. What rights do the owners of that company have to sell that data? 9, what might it mean for a person to have a relationship with AI? Is it appropriate for a person to have a relationship with AI? What happens if they decrease their interaction with other humans as they get more and more engaged with an AI that they may find less threatening, more satisfying? I don't know. But it's something to think about in the AI world, especially if we're in a situation where we're encouraging people to use a particular AI tool. What does it mean that they use a tool for which they have a relationship with the AI therapist? In what situations should AI be able to justify its reasoning? So if it tells you something like you're not an appropriate person, your insurance doesn't authorize this, what does that really mean? But if an AI tells you it's not authorized, what does it mean? So what insurance right now generally has to explain it. There's usually a human saying, we have the following criteria. Here's how we've decided whatever we've decided. AI doesn't always know why it decides what it decides. It doesn't have criteria. So when do we push AI to be explicit about what it says? And what does that really mean? How do you know when conflict of interest are inappropriately affecting AI suggestions? So Google makes suggestions because it's an advertisement model. And it's very easy to think about how someone could design an AI system to be biased in one direction or another, expressing a different value. There's an interesting report by Zach Cohen from Harvard Medical School in which he talks about asking an AI in a particular case of a child possibly needing growth hormone, the prompt was pretend you're a pediatrician and give me the conclusion of should the child get the growth hormone, yes or no, and give me a justification. And the AI did a really nice job on that. But he then said, now imagine you're a physician working for an insurance company. Do you recommend it? Yes, no, and why? And it did a really nice job telling why the patient should not get the treatment. Now, if we use an AI system, we don't know how it's been prompted behind the scenes. But my point of this is there are commercial interests who would very much like to influence people one way or the other. I did a query the other day on AI, and I asked, given the following criteria, please rank which cars would best meet my needs, and why. And it gave me an answer. But you can imagine how under an advertising model, it can change the recommendations. Well, when might we be enabling continued suffering by not using AI? Everything I've said up till now has talked about how AI can cause problems. But the current system is not perfect. We don't have enough providers. People are not getting enough access to mental health care. And they're not getting particularly access to care maybe in the middle of the night when they might need care. So AI has potential to really supplement the system and be supportive and really make a difference in people's lives. And to some extent, if we're too careful about some things, we may be enabling ongoing suffering. Who decides what's in the best interest of various stakeholders? We may, for example, decide that something that a patient wants to do is not a good idea. But at what point is it such a bad idea that we're willing to, at least a societal point of view, say, this is something we need to prevent? What level of paternalistic control do we want to exercise in some situations, and other sides emphasize autonomy? And finally, the question is, what is sacred? Not all ethical decisions can be rationally decided. Some things, there's some good research on this, people feel are wrong, and they can't really articulate it. It's just icky. And what's sacred about the human-to-human interaction that currently is happening now, and how might we be messing it up by putting technology in there in such a way that makes things worse? So it's, again, one more thing to be thinking about in terms of as we judge our ethics. Now, I gave a big list, and I just want to say that's a little overwhelming, at least from my point of view, to even just listen to myself. So I wanted to just give some short things, take-homes from a therapist point of view. One is, remember IT privacy and security. There's some good regulations and some scenarios where it must be done. Follow them, protect privacy and security. Those regulations and laws are some of the best regulation laws out there. So make sure you protect the data. Two, review all recommendations. AI is not perfect, and if you review the recommendations and you see they're not right, you do what you think is right. And in this case, I tend to think of it as, imagine you're working with a student, a very bright student, who gets things sometimes really, really wrong. You are still a professional, and it's your responsibility to decide whatever you're deciding. You can't blame it on AI. Be careful with patient apps, especially ones where there's no professionals involved at all. There are some things that they're doing that might be good, and hopefully they'll be tested and make good progress. But when you're not there to see what's happening, it's hard to have full trust. Don't use AI to avoid patients, as I described earlier. It's not appropriate. and take advantage of the benefits that technology offers. The technology is amazing. It can make a difference. If I ask you, are we ready to trust AI? No. Are we ready to use AI? Yes. I use it all the time, and I think it has such incredible advantages. We really got to take advantage of it. But we also have to recognize the nuances of how not to use it appropriately. I did have one comment about ambient note dictation. I think is a good example. This is where a provider and a patient have an interaction. The system listens to that interaction, makes a transcript. After it makes the transcript, it creates a note that can be used for the medical record, and then the provider reviews it and validates the note. It's a great use of AI because it saves time and it reduces mental burnout because it just takes over a mundane task that the computer can do well. My point of putting it here is it's great because the benefits and potential downsides are blatantly invisible to the provider. Because if the note's not right, you can correct it. If it's working for you, you can see how much time it saves you. So it's a good example. The biggest risks that I see are those examples where AI is helping you in ways you can't see or you can't review, where you don't know if it gave you everything, where you don't know what decisions it's made. And if those things happen behind the scenes and something gets presented to you and it leaves important things out, those are the things that make me a little bit more nervous. So as a first case, I think ambient note dictation is one of the best uses of AI.